This is our Richard Wolf endoscopic system, the first endoscope. This is the latest one, and this is our spinal stenosis endoscope, which has got a 5.6 mm working channel. Then we've got the transforaminal endoscope with the 4.1 mm working channel, and then we have got the smaller length 4.1 mm working channel again, but this is an interlaminar endoscope. And you see that these are the dilators, and then finally we come with this working sleeve, which is a beveled one. And these are the various instruments for the spinal stenosis. We've got a Carson, which is as big as we use in a normal microdiscectomy, so it becomes very handy and very sturdy. And the other instruments are the traditional ones, which are used in the transforaminal. This is a grasper and the other ones. So the endoscopic surgery is the future of spine surgery. We have been doing it since 2000, and now we have got this latest endoscope for the spinal stenosis. So the various things which we can tackle are the discs, the stenosis, and now we can do the spinal fusion, percutaneous full endoscopic spinal fusion as well. Great. So this is the latest thing. So for any patient of the spinal stenosis or the lumbar disc herniation who has got a back pain which is going down the leg, he is unable to walk, he should contact us. I am Dr. Manoj Sharma, Head of Department of Orthopedics and Spine Surgery, Jaipur Golden Hospital, Delhi. Have a nice day.